everyone. Myself, Dr. Rajni Agarwal, Professor Head, Department of Odontology and Oral Implantology, Surendra Dental College and Research Institute, Shri Ganganagar. Today, let's talk about gingival inflammation, that is gingivitis. Now, as we know, the pathological changes in the gingiva occurs because of the plaque which is present in the gingival sulcus. Now, the bacteria which are present in the plaque, they produce the products such as collagenases, hyaluronidases, endotoxins, which cause the inflammatory changes in the gingiva, and there is the establishment of the gingivitis, which further lead to periodontitis. So these pathological changes, they are reflected clinically as the clinical findings. Microscopically changes occurs at ultrastructure level, the changes occur, and because of all these, the biochemical and physiological alterations, they are seen in the gingiva. Gingivitis, when it develops in response to the plaque, the inflammation occurs. There is sequence of events occurs during these inflammatory changes, and the stages of inflammation include initial, early, established and advanced. When there is histologically no change in the gingiva, clinically we do not find any finding, then it is called the pristine gingiva, that is the super healthy gingiva. That is the ideal condition which is required, but still some of the histological changes do occur. So if even clinically healthy gingiva we see in the clinics, that is histologically it is not perfect, though clinically normal healthy gingiva is same. It is called the initial lesion, that is there is this histologically the inflammatory changes they are present as given by Page and Schroeder. Then these initial changes, they get worsened to form, then transforms into the early lesion called the early gingivitis, and then the stage comes in which there is the establishment of the chronic gingivitis, but still there is no bone loss, no epithelial migration, and the gingivitis is called the established gingivitis. Then this established gingivitis or chronic gingivitis remains stable. But when it is not stable, then it leads to the more destruction of the bone as well as epithelial migration occurs, leading to the stage called the periodontitis. So this gingivitis, which is from the initial early and established lesion, gets transformed into advanced lesion called as the chronic periodontitis. Now stage 1, that is initial lesion, discussing it in detail, that is it occurs within the 24 hours in response to the microbial activation of the dental plaque. After this is called subclinical gingivitis because we do not appreciate the clinical changes which are there in the gingiva, though histological changes are there. The character and intensity of the host response will determine whether this lesion will resolve rapidly or it will evolve into a chronic inflammatory lesion. Now the changes which are seen because of the inflammation are in the blood vessels. There is peripheral vessels allow the rapid movement of blood from the arterioles through the capillaries to the venules. The connective tissue of the gingiva, it will have the vasodilatation, there will be edema as well as migration of the leukocytes. The predominant cells during the initial lesion will be the PMLs or the neutrophils, which are the first line defense in the inflammatory process. When there is vasodilatation, there is margination, emigration and diapodesis that results in the migration of the neutrophils into the epithelium, and via the epithelium it moves into the gingival sulcus. So the initial lesion, it has a predominant neutrophils which accumulate into the gingival sulcus, which are the first to fight against the bacteria which are present in the dental plaque in the gingival sulcus. So summing up the features of initial lesion, this is a connective tissue where the vessels, around the vessels there is perivascular loss is seen. The this gingival sulcus, it has the neutrophils, and then neutrophils present in the gingival sulcus, and there are changes in the blood vessels. Classic vasculitis of vessels subjacent to junction epithelium is there. exudation of fluid from the gingival sulcus occurs, migration of the leukocytes into the junction epithelium and the gingival sulcus we see. Then, because the fluid from the blood, from the blood vessels, they have moved out. That is the presence of serum proteins, especially fibrins, they are seen extravascularly. Serum proteins which are present in the blood, now they have moved out, and so the quantity of the plasma proteins or the serum proteins, they are increased. Alteration of most of the coronal portions of the junction epithelium is there. In this, the coronal portion is changed. Also, there is loss of the perivascular collagen. Then comes the early lesion. That is the stage 2. First was the initial lesion. Now is the early lesion which occurs after 1 week. Now there are changes which are seen in the initial lesion which intensify in the early lesion. The lymphocytes, they are increased, though neutrophils, they are present, few plasma cells also present. Now the predominant cells will be lymphocytes. Destruction which was seen around the perivascular area, now it has increased and the destruction so is increased. Leukocytic infiltration is there, inflammatory cell population, it has increased, and now the changes have occurred below the junction epithelium into the dentogingival fibers that are destroyed due to the presence of the inflammatory cells. There is threefold increase in the size of the fibroblast. That is, the fibroblast alterations, they have changed. So collagen fibers, they are not properly formed. The T cells, they are the predominant lymphocyte cells which we see in the early stage. This picture, it shows the dense infiltration of the neutrophils in the connective tissue migrating through the epithelium into the gingival sulcus. Now, it is not that the neutrophils will not be present as seen in the initial lesion. In early lesion, along with the neutrophils, we see the lymphocytes and the predominant cells. In during the second stage will be the lymphocytes. So, features of the early lesion include the accentuation of features which were described in the initial lesion, then accumulation of the lymphoid cells immediately adjacent to junction epithelium at site of chronic inflammation, acute inflammation, cytoplasmic alterations in the resident fibroblast occurs, loss of collagen fiber network, it has also increased, and proliferation of the basal cells of junction epithelium, it is increased because of the destruction of the dentogingival fibers. Then comes this third stage, that is the established lesions, which further occurs after 14 to 21 days. In this is a chronic inflammatory stage in which now the changes, they are intense, in which the predominant cells will be the plasma cells. More of the collagen destruction, fibers will be destroyed and the inflammatory cells are increased. In the established gingivitis, there is condition in which it will be stable. That is, in most of the individuals we see that they are suffering from chronic gingivitis. Only few individuals, they progress to periodontitis. When the histological changes, they are active, then it gets transformed into the more periodontitis stage, towards the periodontitis stage. Acute inflammatory changes now imposed on the chronic inflammatory changes. So, in the established lesion, there is persistence of manifestation of acute inflammation. Plasma cells, they will predominate, but without appreciable bone loss. There is no bone loss, there is no loss of attachment until here. That is the chronic inflammatory stage. The predominant cells will be the plasma cells, though neutrophils and lymphocytes will also be present. These plasma cells, they will produce immunoglobulin within the connective tissue and the junction epithelium. The connective tissue loss will be increased and there is migration of the junction epithelium occurs. That is apical migration and extension, it starts occurring in the established lesion. If it progress, this established lesion, it progress, that is the active changes, acute changes on this chronic inflammation continues, then it will form the advanced stage. That is the phase of the periodontal breakdown in which there is bone loss occurs, periodontal ligament loss occurs, continuous loss of collagen in the gingiva it occurs, and pocket formation is seen. In this stage, the inflammation, it is not that it is progressive, it is always continuing. There are always areas where the quiescence and exacerbation of the gingivitis is seen. Conversion of bone marrow distant from the lesion into the fibrous connective tissue, it is seen. Widespread manifestation of inflammatory and immunopathological tissue reactions, they are seen. In this stage, the predominant cell type, it will be the plasma cells with neutrophils as well as the lymphocytes, depending on the acute and the chronic stages which are seen in the different areas of the gingival tissues. So, to sum up the gingival inflammation stages: initial, early, established, initial within 2 to 4 days with changes in blood vessels. First is the vasodilatation, predominant cells, they are the neutrophils, perivascular loss is there, that is around the vessels, collagen fibers, they are destroyed, and the fluid from the vessels, they move into the epithelium, from the epithelium it moves into the gingival sulcus. So gingival fluid flow will be increased, that is the gingival crevicular fluid, that is in the crevice the gingival fluid will be increased. Then in the early lesion, that is 4 to 7 days, the vessels, they proliferate. Along with vasodilatation, there is proliferation of the vessels. Changes are seen as those in the stage 1, along with more of the atrophic areas are present. Lymphocytes, they are predominant cells. There is increased loss around the infiltrate, and clinically we will see red gingiva, that is erythematous gingiva is seen. Bleeding on probing is present. After that, within 2014 to 21 days, we see the chronic gingivitis stage, that is the established lesion. In this, the changes which are seen in stage 1 are accentuated with venous stasis. Because of the venous stasis, we see the bluish hue in the gingiva. Stage 2 changes in the epithelium are those that were seen in the stage 2, which, but is more advanced. Predominant cells are plasma cells, and continuous loss of collagen occurs, and because of these changes we see the color changes, size, texture. Now loss of collagen, it will lead to soft edematous gingiva. More of the venous stasis, it leads to the bluish reddish blue hue in the color of the gingiva. So the changes which we see, they are more accentuated in the established lesion. If this lesion remains stable, the patient will have the chronic gingivitis. If it is not stable and progressive, and then it will result in the parodontitis. So initial and early stages reflect histopathology of clinically early stages of gingivitis. Established lesion, it reflects the histopathology of chronic gingivitis, and the advanced lesion, it reflects the progression of gingivitis to the parodontitis. So I hope we have it is clear the stages of gingival inflammation, how the gingivitis it progress, and from gingivitis how does it convert into parodontitis. Thank you.